Hello everyone, in this tutorial we are going to show you how to dissect the gluteal region, posterior thigh and popliteal fossa. For your orientation, here's the lateral side and here's the medial side. We put the skin incision and as soon as you see muscle fibers of the gluteus maximus, you're on the right plane. The muscle fibers of the gluteus maximus. Okay, now we put that incision along the inferior border of the gluteus maximus. As I said, as soon as you see muscle fibers of the gluteus maximus, you are on the right plane. Practically, that's the deep fascia of the gluteal region. Here is gluteus medius covered by the layer of fascia, and here is the boundary of the gluteus maximus. Now we put the skin incision on the posterior thigh, right on the midline. Now we are going to put the cut on the posterior thigh, not very deep cut, shallow cut, okay, particularly in the popliteal fossa, try to make it shallow cut. And then when we reach the posterior leg, we put the horizontal or transverse cut like that, again really shallow. See that how shallow it is? Then you can make it a little bit deeper. When it comes to the posterior leg, I suggest you try to find the deep fascia on the posterior leg, posterior thigh, sorry. It's better actually we save the deep fascia, that you can see the thickening of the deep fascia on the posterior thigh. Practically, I had removed the skin with the fascia here, but in this part, I'm saving the fascia. As I said, when you put the skin incision on the posterior leg, on popliteal fossa, you want to stay shallow because we don't want to cut the small saphenous vein and pseudoartery right under the skin here. particularly here on the lateral side of the popliteal fossa. We want to be careful not go very deep. Here is the head of the fibula. We want to look for the common fibular nerve here. So this is the deep fascia of the thigh. Remember, it's called the fascia lata. This is a cutaneous nerve which supplies the posterior thigh, the posterior cutaneous nerve of thigh. See that? Okay, now I'm going to go to the gluteal region and then reflect the gluteus maximus. Okay, now we find the inferior border of the gluteus maximus. And here is the superior border of gluteus maximus. See that? It's the border line between gluteus medius and gluteus maximus. I'm starting to cut the gluteus maximus from the sacrum here, and ischial tuberosity is ischial tuberosity somewhere around here. So when you cut the gluteus maximus, try to stay as close to the bone as possible. You don't cut the piriformis muscle underneath. Try to stay superficial and see the muscle fibers of the gluteus maximus. And here gluteus maximus attaches to the sacrotuberous ligament. You see is a fascia between the muscle and ligament. Be careful for the sciatic nerve here when you are detaching the muscle. Remember, that was the posterior cutaneous nerve of thigh. So now it is just a fascia between the muscle and underneath muscle. Bundle of the nerve fibers and blood vessels coming to the gluteus maximus. That's the inferior gluteal nerve and inferior gluteal artery and vein. We have to cut the inferior gluteal nerve and inferior gluteal vessels. We don't have any choice. Otherwise, we cannot reflect the gluteus maximus. But we leave a stem of the nerve with the muscle that you can review later. Right here is the greater trochanter and a bursa between the muscle and greater trochanter. It's a good time to see this bursa. Right there. Then we try to find the boundary of the gluteus medius and piriformis. Then I cut along the border of gluteus maximus. You see the nerve fibers coming to the gluteus medius, along the border of gluteus medius, and you see the nerve fibers coming to the muscle. So what I see here is the bundle of the artery and vein of the superior gluteal artery and superior gluteal vein, and the superior gluteal nerve. That is the nerve, and these are the vessels. And right under these, we have the gluteus minimus. This muscle is gluteus minimus. Now I'm going to go to actually dissect the piriformis muscle. Here is the boundary of piriformis muscle, passing through the greater sciatic foramen to come out from the pelvis. This is sciatic nerve. Right here, this part, we have the deep gluteal muscles. Of course, the piriformis muscle is one of the deep gluteal muscles, but the rest are here, so I'm going to dissect them. I do it very gently. What I'm trying to find here is the tendon of obturator internus muscle. This is the tendon of obturator internus muscle, and this muscle above that is superior gemellus, and this muscle below to that, inferior gemellus. Then we pull the sciatic nerve aside, and right underneath here, this muscle is quadratus femoris. Under quadratus femoris is obturator externus, but then if you want to see that muscle, we have to cut this muscle, which is not worth it. So we assume that the obturator externus is under the quadratus femoris. In most cases, when we dissect the gluteal region, we have already dissected the pelvis and perineum, so then practically the student have exposed the pudendal nerve and internal pudendal artery here, which is not part of the gluteal region tutorial anyway. I'm trying to clean the sacrotuberous ligament. That is sacrotuberous ligament. Now we want to dissect the muscles of the posterior thigh. Remember that nerve was posterior cutaneous nerve of thigh. This is the deep fascia of the thigh, fascia lata. I'm detaching from the muscles. See how just the loose connective tissue between the muscle fibers. These are the branches of arteries coming to the muscle. We don't want to save them. This muscle that I'm reflecting is semi-tendinosus muscle. That is, see, half a tendon right there. Semi-tendinosus. And that is semi-membranosus. The muscle on the lateral side, biceps, femoris, with two heads. That's the long head of the biceps femoris, and that is the short head of the biceps femoris. Now I'm going to dissect the sciatic nerve. Now we see two branches of the sciatic nerve, one on the lateral side, one on the medial side. The medial side tibial nerve, lateral side common fibular. This is the part that I said, just put the shallow skin cut, because there is a possibility we cut the common fibular nerve. So common fibular nerve has a branch known as communicating sural nerve, which joins the sural nerve. So that is the communicating sural nerve, and that is the common fibular nerve, and this branch should be lateral cutaneous nerve of calf. Now I'm going to go with the tibial nerve. That is our small saphenous vein, which drains into the popliteal vein. I'm going to hold on that. That is the tendon of semi-tendinosus muscle. Now we are in the popliteal fossa, and I want to find the heads of the gastrocnemius muscle. That's the medial head of gastrocnemius muscle. That's the lateral head of gastrocnemius muscle. As you see, these are the branches of tibial nerve for the muscles of the posterior leg and also knee joint. Now I'm going to go into the popliteal fossa. This is the popliteal fossa. I want to go deep and find the nerve and vein here. That is popliteal vein, and underneath is popliteal artery. That's the popliteal vein, and that is popliteal artery. They pass through the opening in the adductor magnus muscle. That opening in the adductor magnus muscle, right here, known as adductor hiatus, right there. Okay, so we are in the popliteal fossa. Now we want to find branches of the popliteal artery known as genicular branches. That could be one of them. There are several genicular branches. One here, hopefully you can see that, right there. One here, right there, my scissor is underneath. Can you see that? Right there. And since we are in the popliteal fossa, it's good to see one tiny muscle here on the lateral side, right here, that is plantaris muscle, right there. And also in the popliteal fossa, deep there, right there, hopefully you can see that, right there, is popliteus muscle. However, it's better we dissect the popliteus muscle when we do the posterior leg. It's easier to see that muscle with the posterior leg. Now I'm going to actually go back to the posterior thigh and show you some of the branches of the arteries coming to the muscles. Now in the posterior thigh is the branches of the arteries coming to the muscles. These are the perforating branches of the profundofemoral artery. And good to know that when you're looking at the posterior thigh, so remember biceps femoris, long head, short head, semitendinosus, semimembranosus. Any other muscle you see here are the muscles. This is the adductor magnus right there from the anterior leg. And then on this side we have the vastus lateralis. But you don't need actually to go through these muscles from this view. So that's all about the dissection of the gluteal region, posterior thigh, and popliteal muscle.